Good evening and welcome everyone. And let's start our meeting with a silent prayer. Good evening and welcome all the participants. Today is our 899th day. Tomorrow we are celebrating 900th day. So our session will start from 7 to 9. Earlier, 1 hour earlier than the regular timing. So everyone should care about that. 7 o'clock we will start our session because we are celebrating our 900th day. So I'm grateful to all the participants and those who are contacting and struggling behind this Zoom session. And today's our guest is Dr. T.K Nagendran. Dr. joined. Or guest Dr. Manoj.
Not yet joined.
Not yet joined. Okay.
Yes.
Okay, and we are going to celebrate our family meet on 19th of February. Thank you all the participants for your support and contributions. And now I will introduce Dr. Nagendran. I think he will join soon.
Yes, doctor, we can complete the formalities. Please proceed.
Okay. T.K Nagendran, MD, he is the first MD scholar from Kanyakumari district, and he is a professor and he worked under UG and PG level under Ayush department. And he really worked for the upliftment of homeopathy, and he is the first COVID warrior who proposed Ayush for ASALB to use ASALB as a preventive medicine. And he is the doctor who works in village and really working for the people, and he's a very soft-hearted person. And today's his subject is my experience in homeopathy. He has taken 4 classes in our forum, and I'm welcoming Dr. T.K Nagendran. Not yet joined, I think. Someone have to contact him directly.
Yes. He will be joining within 2 minutes.
Okay.
He just came out.
And
of
once
his
again,
clinic.
I think few more participants has joined again. Once again, I'm remind you that tomorrow our session will start from 7 o'clock. We are celebrating our 900 days. 7 to 9 will be the session. So, and once again, I'm talking about our family meet. And those who want, no voice, huh?
Yes,
Dr.
we can hear. Yes, we can hear. Yes. It's problem.
Maybe Rasa, I think your internet connection is not proper. That's the reason they can hear me. Thank you. Thank you everyone for your contribution, and we still receives contribution. If the international participants want to send money, means please send to another account number, and please contact someone from Ifph from your chapter. And what else, Dr. Manoj? Anything else to add?
Nothing more to add, but what is more important is the physical meat, and of course, you have to design a lot of things for making homeopathy the #1 system of the world, because there are enough chances. Last couple of weeks, I think the last 1 week, you had a lot of topics from different doctors, and almost all are only dealt with homeopathy. without damaging the patient. So that means the possibility is there. Then we have to explore it. We have to capitalize on that. That is more important. So in that direction, I think IUPH is doing a lot of works.
Bhaskara Verma.
Yes, definitely. Regularly, his mic is always knowingly or unknowingly open, so that always noise coming from that side. Of course, we have
Dr.
provision.
T.K Nagendran has joined.
Yes, he's always a busy person. That may be the reason. Yes, sir, please, you can proceed. His audio is not connected. That may be the reason.
Yeah, it's
Yes, sir.
connected now. Now you can unmute yourself and talk, Doctor.
Hello.
Yes, Doctor.
Hello. Very nice to meet you all. Good evening. Anyway, God given pleasant time to meet you all. Thank you for you and God and our organization. They are tremendously working. I am giving one salute to them. Those who are doing betterment of uplifting our homeopathy system. Today, around 4 o'clock, I received a call from Iran. Our Dr. Bagiani, he is from Iran. He suggested and given one discussion. You kindly do this topic like that. He is given some suggestion to discuss one particular topic. Today, that's why I also felt to talk in that particular topic, what I can do it. As a homeopathy concern, instead of telling that disease and all, I will gather the symptoms and signs regarding that particular disease and what way we can treat that particular problem. Because it is generally day-to-day practice today, everyone is getting such a problems. And many times I got failure to treat such a disease. Especially, I will tell you, one person, she is around 60, 65, 62, 60, within that. She came to me and she had a problem of severe burning. Severe burning. She is having complaining burning in the vertex, burning in the nose, burning in the tongue, burning in the throat, burning in the skin, and everywhere. And burning in the vagina, burning in the anal region, everywhere. And especially, she got burning in her feet and foot. And with severe burning, whenever she is keeping some water or somewhere, she is, if she can keep her both lower feet inside the water, she got some freeness. And that is the main problem. And she is having severe sugar level also high in nature. Her urine level, and once she came to me for burning, then after that she told that she is having some sugar problem and all. And we suggested the medicine, and that external burning is too much seen throughout her all symptoms. And her way of sitting, walking, everything is stupid. She is unable to stand even 5 to 10 minutes. She is weak and all. And whenever she wants to sit, she is sitting like that only. And we given the medicine with our homeopathy system, she is improved a lot. Her burning is reduced. And whatever she is having other diagnostic problem, that problems also reduce much more. That is the one main case I found. And this polycrust medicine, oftenly we are using it. That same way, our another one person, he came to my clinic, and when I told him to occupy his position, chair, he was sitting first. After that, he is discomfort with that chair. And he told me, your chair is moving here and there, little bit. Whether anything wrong with your chair. Then I felt anything, because before his appointment, another one stout person arrived, and he is sitting. He is not complained anything, but it is related to his mind symptoms. Because he is sitting, he feels that chair is lifting like that. Moreover, that even though she is old age, she told myself, I am settled at Chennai previously. Now I came to your city. I am not comfort here. That's why if I go to Chennai, Madras, I will be better. Oftenly, he is telling this to even his relatives also. And he is this first patient and this patient, everyone have severe numbness and some feelings of stitching pain or pin-like pains, everything they are not able to narrate. Such a way, they have some uncomfort feelings and sensation, stitching or pain, some severe sensation is there in the feet. They are telling that we are not able to lie down. We are not able to walk. We are having continuous pain in our feet and all. That is pricking type of pain. Pricking type of pain is there in feet and all. And it is some abnormal, unpleasant sensation also felt. And it was cured with our medicine. And moreover, there that patient have oversensitive of his skin and all. And whenever he is talking with someone, he is always talking about his native. He want to go to his native, and native in the sense Chennai. Even though Chennai, no one is there, but he is born and brought up from Chennai. He is having severe homesickness. And that thing was healed up with our medicine. Because this time, every medicine is different, but the problem is more or less same only. And the same way, another one person, he is having complaints of kidney problem, and he is coming with his reports, everything. And he told myself, my kidney is severely affected, and myself in even that sugar and albumin is present in my urine. That's why it is possible to do anything with the homeopathy, he asked. And another one problem, what happened? No, he is unable to aware. He is not able to find out his bladder is filled. He is having retention of urine also. And many times he is not able to found out, and inability to swallow anything. And he is not able to take proper food. He is affected with paralysis in the throat. And they came for that purpose. At least he has to swallow little ganji. Ganji means rice or something they want to take. But the person is not able to take even water. He is telling some severe problem is there in throat. That's why what I can do, whether we go for surgery or you can do with anything. There are some one medicine I found out and I given that medicine. He is literally taken that tender coconut juice and fruit juices and all. Within 2 or 3 that she is around 85 to 90 years old lady, I think. Even my YouTube, I put herself. She is an old lady, but she was very fine with this medicine. It is a very good medicine for that paralysis in the throat. But this all medicine, whatever I am narrating, every medicine have very severe numbness in the feet and a pin like stitching, pain in the feet. So many problems are there. That is discomfort with so many numbness and some other problems related with the pains. And another one person we treated with another separate case. It is a very wonderful, because usually we will get numbness in the feet, but this person have numbness in the mouth also. He is unable to swallow, and his speech also not in proper way, stammering. Whatever he talk, we cannot able to understand that talking style. No, he is telling one thing and we are hearing another thing, and inability to stand himself, and his knees are very much affected. He needs support. Whenever he is coming to consultation, he is catching the windows and coming. And here also severe numbness is there. Severe numbness is there. And another one thing, what happened? This all patient have, she is affected with another one problem. She mainly came for herself. She is having warts in her face. And another thing, she is having pounding of that ovarian cyst. That ovarian cyst, she was told myself to get rid of that ovarian cyst. We want to take treatment. But with our medicine, she is comfortable with that. And moreover, the same problem, this I am telling, in this all drugs, that numbness, tingling, and some unexpressible, or they cannot narrate the sensation what they found. And severe weakness is there. And majority of this, all drugs are having the diabetic problem. Sugar level is more. They are so much tired, so much frustrated, and they have thirsty. This all problems are there commonly with that. And another one drug, this drug also commonly we are using for the same thing. That what happened, this is old age person, unable to perform. Impotency is one of the main criteria. Moreover, this person is unable to spell, unable to talk. His mind related work, he cannot able to perform even small work. Here also, and especially affected with the right side, and he is having some digestive problems. This all thing taken care of with our medicine. Our medicine, and it is a wonderful medicine. And that fellow have severe gastric problem, and he is feeling that that lower abdomen is filled with pressure of gas. Gastric problem is there. Both problem is relieved. Gastric problem is relieved, and his numbness is relieved, and his impotence is relieved. It is already we discussed in some other cases also. And another one special case. Now, after the problem is arised due to some severe problem was there, that problem is not completely relieved. No proper here occurred due to incomplete treatment, or treatment is prolonged, still that problem is sustained. That type of people have coldness in the fingers, and nails are blue. Excessive flatness is also there. It is the flatness means the pressure is upwards. This person's, this medicine is specially nowadays we can use. We are getting more and more medicine in the corona affected patients, those who are already affected, and they are now coming with one or other problems. This medicine is specially indicated for their people, and that their problem is relieved with this best medicines. And another one medicine, this is the same criteria, but even here all whatever I told, all medicines have numbness is there, pricking pain is there, some discomfort is there in walking and all. And here, whatever, no, here pain is there, even light touch will aggravate and it will show more and more pain. But severe pressure will be relieving, giving relief. That is the wonder of this drug. And what I am narrating, this all about one particular problem, what our doctor informed regarding that. Can you tell anyone who want to tell? In all drugs, the numbness is there and they cannot able to walk properly due to damage or cause of some nerval problem, due to damage of nerves. And sugar is more many times. This all medicines are specially we can use for diabetic polyneuropathy. In this all cases, we can see special development. In diabetic polyneuropathy, we can see the sugar level will be more. Moreover, the feet, there the blood circulation of small capillaries are damaged. That's why the nerves coming from spine to downwards, that lower limbs and all will be got damaged. And due to over that sugar, that contraction will be there, that damage of capillaries and the nerve system will be severe contraction. It is shortened. That's why they may not able to walk also properly. And another one thing, in this diabetic polyneuropathy, we can judge the patient. If you tell them how you can tell the patient to keep particular place, to keep their limbs, their toe. He may not be able to keep that particular toe in particular place. Or closing his eyes, if you tell him to touch his toe or something, some portion of that feet, he may not able to keep or found out in short time. He will take much more time to identify where is his toe, and he cannot judge where is his leg is there. His mind coordination will be very limited. And this, I told that China is one medicine. It is the for the light touch will be aggravate and more pressure will be decrease the pain. It is the China. And this corona, still corona is there. That bad effect of corona patients we can meet day to day. For them, due to their complete relief, we can give carbo veg. And in lycopodium also, we used to perform, because here, due to that diabetic polyneuropathy, they cannot even perform ordinary that routine mental work due to incoordination of that. And even that plumbum metallicum, it is also one of the best medicine. We can see that kidney affection and albumin is present, even sugar is present in the urine. Here we can give it. Moreover, that lack of sensation is there, that bladder is filled. Here we can see that our plumbum metallicum is very much useful. And here another one thing in plumbum metallicum, one special thing, that person's toe and all, we can see that it is just like a washerwoman, that fingers and all, it is cracked. Even gangrene also we can found many times. It is the wonder of the plumbum metallicum. It will act nicely. And the another one thing, in plumbum metallicum, the person will be get paralysis of throat, inability to swallow. Here we can we have to be differentiate plumber metallicum with causticum also. Causticum also, there some problem is there related with throat, and there we will feel that some feather-like sensation is there, or some obstructions will be there. That's why the person may not be able to swallow. This is there also. Causticum also one of the wonderful drug what we can practice day to day. And in Bovista, we can see the ovarian cyst and even that warts, horns, that skin problems, everything is there. Moreover, this all medicine, whatever I am narrating, all medicine is specially suitable for that diabetic polyneuropathy. Because while instead of taking the name of diabetic polyneuropathy, the main symptoms, the numbness, the pricking pain, the inability to walk, inability to judge where the foot is there, where the toe is there, in that all condition, if it is accompanied with other stammering speech, they cannot talk, there is ovarian cyst is there, such a condition, if it is there, we can give Bovista. Like that, another one more medicine is there, wonderful medicine, that natrum sulfuric, natrum muriaticum. Natrum muriaticum is also one of the best medicine. Here also numbness and tingling of tongue and toes also there. Here the patient will be so much moody and weeping tendency is there. Even we have to be differentiate the weeping tendency from pulsatilla and all. And here another one thing is natromore will be craving for salt. The tongue itself unable to found the taste. How much you put the salt, even then patient will be craving for salt. That's why the loss of taste is found in natrum muriaticum. Because those patients having problem with taste buds and they are craving for salt with numbness, we can think of our natrum muriaticum. Here the weeping tendency is there much more. These are the main medicines we can use day to day for diabetic polyneuropathy. In addition to that, we have to be think other medicines also. Epiterium perfluatum, that arsenicum album, even phosphorus, even cecal core, this all, even that single that our regular routine arsenic, that aconite, chamomilla, restox, this also will be useful very much for our diabetic polyneuropathy. And we have to be see that what are the common symptoms we are getting it. If in all polyneuropathy cases, we are getting the symptoms like pricking pain, some uncomfort sensation feet, and they are unable to perform their routine work. What that normal person can do, that thing they cannot able to perform. This something we have to be calculate. After that, we have to be find the particular direction to the particular drug. If impotency is there, some liver problem is there, then we can think of lycopodium. And some that other problems like weeping tendency is there, paralysis, unable to find out the taste, then natromore we can think about. Like that in Bovista is there, means numbness is there, ovarian cyst is there, then we can go for diabetic polyneuropathy. Usually patient may not come for that diabetic polyneuropathy, they will come for other problems. But after that, they will tell that that our diabetic polyneuropathy problems also. That's why our medicine is one of the best medicine. We can treat this diabetic polyneuropathy in good manner. Hello. Hello?
Please continue, sir. Please continue.
These are the things we can now discuss. There are a lot of drugs are there. Now arsenicum album is there. Arsenicum album is one of the best drug. But we have to see the aggravation 1 to 2. That is the arsenic album. There, the banning sensation will be there, external as well as internal. And that cases we can even think of arsenic album. Now phosphorus is there. There the banning sensation we can get more in internal aspect. And the cecal core is there. It is one of the excellent drug. Even we can utilize in many cases. But and another one thing, what we will tell, we are thinking one particular symptom, and instead of searching that, we can study the person as how he is and what predominant symptoms we are obtaining from him. Accordingly, if you treat, we will get a more success rate. Then tell me, sir.
Sir, I think you can continue 10 more minutes, then we will go for discussion. That will be.
1 minute. Hello?
Yes, sir. Tell me.
Okay. Okay. Now, even common medicine, common that aconite is there. Aconite is, even though it is common, but it can also able to give comfortness in the diabetic polyneuropathy. There we have to see the tension. Tension is the keynote of the aconite that we can get, that fearness, because once that person is affected with polyneuropathy, that person themselves, they will get depression, and they will afraid whether we can able to walk, we can cross the road, this and that. These are the main criteria and main symptoms what we found in the aconite also. Even belladonna also many times we can, because it is having burning sensation, irritation is there. Irritation in the sense that once he cannot able to perform his routine work, routine schedule, that fellow may get irritation. And even due to other problem, he may get even delirious status also. There even your belladonna also work out. There, that same way that Apis mellifica is there. Apis mellifica also one of the best, wonderful drug. It is not only we can use for that insect bite or the causation or the problem arising to that bite of insect or poison of that stings. Even this medicine will be best to use for that diabetic polyneuropathy. That same way we can think about even capsicum. Capsicum also work very marvelously, but it should be suit. It should be indicate for that particular person. You can think of capsicum. That same way we can think about the repeated urination, that burning maturation, everything. Even our routine Candaris is a wonderful best medicine. We can give it, and even we can give this Candaris is a very one of the best medicine for giving diabetic this and all. But we have to see that this medicine will be suit for this or not. That is the skill, or that is to be advised. What is the right medicine? What is the right time to prescribe? Once if we know the proper medicine, and if you are administrating in the proper time schedule, you will get all right. But in sulfur also we have to be thinking about sulfur. If it is a causation due to any psoric cases, if any obstacles you can found, that time you can give sulfur. Moreover, instead of that sulfur place, even you can give your sorinum or causticum or any other things also. But we have to be think, and we have to be found out what are the things to recover. What are the need of medicine to remove that obstacles. We have sulfur also, very wonderful drugs. We are getting marvelous drugs. It is a polycrust remedy, and there are a lot of symptoms are there in associated that whatever I narrated, every medicines have these symptoms. What symptoms? Numbness is there, some unpleasant, the piercing pain or pricking pain, or they even cannot able to tell that pain. That is the thing. And their mental status, many times they cannot able to perform their even normal routine work also. The incoordination will be there. Those who are affected with diabetic polyneuropathy, there will be incoordination. Incoordination, they may feel that they want to take one step, but the feet may not move. And where is feet, they don't know. Whether if they want to wear chappal, they cannot able to feel the chappal, the slipper is properly sitting in the feet or not. They cannot able to judge. And if you tell them to touch that particular portion by closing or sitting, you touch your toe, they cannot do many times the performance. That's why easily we can make out, and thus our system of homeopathy is having wonderful work with that. And even that corona, now there are a lot of patients are with this sudden other system of medicines. They given medicine, it is increased that sugar level more. Due to that, so many people are affected. Still, they are with severe medication and all. That medicines are, that people are also having severe diabetic polyneuropathy and all. There also we can give our carbo veg. Carbo veg have very miracle action on this our corona affected people. It will be rectify and fulfill and work out clearly. Okay, these are the main criteria. There are so many medicines are there, so many things are there. It is shortly what I come to know that what I did, I was narrating, or we having exchange our thoughts to you people. Thank you.
Thank you, sir. Now we will go for discussion.
And it is today's this program was actually our Iranian doctor brother. He is called myself around 4 o'clock. Because of that, only I thought we will talk with him. Anyway, salute to him also. Okay.
Thank you, doctor. Thank you for your class. And M. Rasa, you can talk now.
Yes, hello, sir. Thank you for your good session. It's very, very complete. Thank you. I
Show
want
your
to
face. Let me see you also, sir.
thank you, sir. Yes, sir.
Show your face.
Okay, sir.
We can see you.
Okay, sir.
Very nice of you, boss. Very nice of you. Whether it is useful to you.
Yes. Very, very nice. But first remedy, sir, you said about China. I think the first remedy you said. Hello.
Tell me, sir.
The first remedy, because of internet interruption here, I can't hear you. The first remedy, I think you said about China. It's okay or not?
Dr. Nagendran, please unmute yourself and talk.
Hello? No. Other phone call, no? It's due to that interruption is there.
Yeah, you're talking through your mobile, right? I think.
Hello? Continuously one fellow is phoning to me.
Yeah, sir, I think it is better to take classes from the computer. That will be easy for us. We cannot view your face even while you are taking classes. So while for the next time onwards, you you have to take classes from the computer. Otherwise, it will have fluctuation and.
Yeah, now only, and Saris asked about China. I was not only narrated China, even this problem is with even Lycopodium also there, Carbovig also there, China also there. 3 medicines are there, but the 3 of them we have to know how to differentiate on what circumstance we have to be give. If China means in associated with this diabetic polyneuropathy, what we are getting symptoms with that fullness of that gaseous state we can found in China. In Lycopodium, we can get even with the same status with low that the pressure is gaseous, gastric problem is in lower region. In Carbovig, it is there in upper region. That's the way we have to be differentiate, little differentiation is there, and we have to be accordingly we have to be proceed.
Thank you, sir. Now, Dr.
Thank you, sir.
Now, Dr. Hariharan can ask us. Hello?
Hello, can you hear me?
Yes.
Please, sir.
Okay, sir. Good evening. Good evening. Very
Good evening,
class.
boss.
Very good.
Good evening,
Very
boss.
good class. See, diabetic neuropathy is very difficult to cure in my opinion, but surely we can give relief. That is
Yes,
what
sir.
I like to say.
Yeah,
a lot
yeah,
of medicine for diabetic neuropathy. See,
Yeah.
almost all medicines you have said, but I like to say some more drugs.
Please.
One is the agaricus.
Agaricus.
Agaricus. That the symptom is creeping sensation like ants.
Yeah.
That is the symptom of agaricus.
Yeah. That is the thing I told clearly. There are so many sensations we can found, and even many times patient himself unable to narrate the sensation.
See, a lot of sensation for diabetic neuropathy. See, another is I like to say, see, numbness of the whole body and coldness of the hands. That medicine is cicuta. See, another medicine I like to add, see, numb feeling all over the body and great debility, trembling and twitching. That is conium is the medicine.
Very nice, very nice.
See, our next medicine is numbness of hands and soles and feet. Raphanus is the medicine.
Very nice.
Raphanus. See, here comes patches of the skin with the loss of sensation. Bufo. B-U-F-O, Bufo. Is the medicine. See, crawling in paralyzed parts, numbness in spots. Cadmium salt is the medicine. Cadmium salt. See, here another medicine is conductivity of the nerves impaired, numbness of the sole of the feet, in coordination with the other limb, that is alumina.
Alumina, even we can see that severe, that even he cannot, patient cannot pass stool due to paralysis in the.
Okay. See, a lot of other medicine. I am not going to comment other medicines because time is so much. If time, I can say a lot of medicines with the symptoms. So because I am treating this. Because I am treating this. So I know all this medicine and how to treat it. Then another thing is you have to reduce the sugar. That is very important. Even though they are taking the insulin or the metformin or any medicine, I am sure that we can reduce the sugar by homeopathic medicine along with the allopathy.
Without see anything now, there are mother tinctures are there. We can give that also.
See, sir, along with the mother tincture, we can give the potency also.
Also,
According
that's
to the
a-
constitution,
that
we can give. But the only
That
thing
is-
is, if you give the constitutional medicine, please give the lower potency. That is my opinion.
That's
I
the
am
thing.
ready.
Always I will tell even 30 or 200 moderate. It is
It is
okay.
good.
I think so.
Even 6x also is good. See, lycopodium
It is best.
6x. Lycopodium 6x. It is a wonderful remedy along with natural self. You try
Yeah.
it. Okay.
Natural self.
Okay. Natural self is a wonderful medicine, but use natural self the 12x only. I am using 12x. I am getting result also.
Even 6x also we can give instead of ferrambas and silicia we can give 12x. Natural self even we can give 6x also. It will also
Okay.
giving miracle result. Even
Okay,
for those who are affected with diabetic, blindly we can give natural self and some saginium or gymnema or something mother tincture also.
Today, a patient came to me and after 1 week, her considerably her sugar is diminished. And along with that, see, cholesterol is also diminished.
Yeah.
I myself wanted.
It is the miracle of homeopathy. Once we are treating the ovarian cyst, the patient affected with a particular problem, that same medicine will be caring that. Bovista is caring about that polyneuropathy also. Diabetic also it is caring.
Okay.
If we are in appropriate dosage, appropriate medicine, it will be what she is coming for that ovarian cyst. Ovarian cyst also gone, her diabetic problem also reduced.
Okay, doctor. Thank you.
Thank you,
Doctor.
boss.
Thank you.
Thank you. Nice of you, boss.
Thank you, Dr. Hariharan. Now, Dr. Manoj, please.
Okay, as always, we expected it's a nice presentation from Dr. T.K Nagendran. Is always practical. And most importantly, he is working in the grassroots level. So thus spreading homeopathy. We all know that our Jose Isaacs are spreading homeopathy in an international level. This man, Dr. Nagendran, is always it is going the other way. That these all modalities are needed. Wonderful presentation. And I think the importance of this homeopathy is that it's a practical science. The sensation as if. Now a lot of discussions are there. 2 books, textbooks are there. One is by H.A. Roberts. Then another one is what sensation as if. In 2 volumes, thousands of symptoms are there. So that's a wonderful work. It makes homeopathy most practical therapeutic tool, I think. So without going or sticking on to some technical aspects, we can give medicines immediately. Even though in undiagnosed cases or inaccessible cases, where also it becomes a practical system, the importance is that we never added some technicalities in homeopathy therapeutics. That is why it is beneficial and useful even after 225 years. If it is filled with the so-called preferably Greek terms, the diagnosis, our materia medica cannot be used now. But why we are using this materia medica? Because of its simplicity. So that is the most important thing. So that is the specialty. I think there are no other therapeutic modalities or tools in the world which can use all these individual diseases. The individual consideration is only applicable through homeopathy. That is the most important thing. Anyway, nice presentation. Congratulations, Dr. Nagendran. Thank you.
Thank you, sir. Thank you for yourself and our farm and that madam, and especially for Dr. Bagiani from Iran, who initiated to talk something regarding that. As you told, it is useful, and we thank to God and all. And even we may meet on coming your gathering on 19. We'll meet together, get together also. with God essence.
Thank you, sir. Thank you for your acceptance of our invitation. Dr.
Nice
Hariharan.
of you. Anyway, we'll meet you there.
Yeah, we'll meet. Dr. Hariharan have question again, I think.
So it is not a question, but it is my suggestion that like homeopathy treatment, see in allopathic treatment also some obstacles. In my observation, a patient who is treating, he is undergoing allopathic treatment. Suppose they say that medicine is not reacting to that, reacting to the body. They say like that. But at that time, if we give some miasmatic drugs, see suddenly the body will react. Whatever may be the system of medicine. But obstacles can be cured by homeopathic medicine, in my opinion. I have seen that.
Even in Corona, that COVID-19, that other system of medicine they provided, even though normal routine people, they also got affected with high level sugar in blood, even 400, 500 level, it is increased and they was treated with insulin, those who are admitted with COVID-19. But due to that bad effect, even now we can treat with the carbo veg.
Very correct, very correct, very correct. Simultaneously, we can use the homeopathic medicine and save the patient. The capacity of the vital force can be increased by the homeopathic drugs.
Because in carbo veg, even though it have one better symptoms, those diseases not able to healed or treated properly or completely, that thing will be taken care by carbo veg. In that aspect, we can give carbo veg for this corona affected people.
Sir, Joseph said, sir, what is your opinion regarding this? Please tell.
No, I did not hear it properly. So just now only I ended.
Okay.
Anyway, nice to see sir's face. He is always smiling face. Huh? It is just boosting.
Sir, there is a question in the chat box. Sir, which potency you prefer in the diabetic neuropathy?
I will prefer 30 or 200, madam.
Okay. That's it.
And repeated dose.
Yes. Regarding the condition where when medicines are not responding, the most important medicine is opium. Just mentioned by Dr. Samuel Henneman in Aphorism 183 footnote, where you can see, you can activate the vitality when the patient is not responding. That's the most important thing. That is directly or indirectly everybody accepting homeopathy. Who is responding? It is not the body. It is not the organ, but it's the patient. Who is that patient? The medical science cannot tell. That is the most important thing.
Opium is very wonderful drug. Because it having all signs and symptoms of diabetic polyneuropathy, everything. And very nice. But our opium is beneficial. But nowadays, youngsters are taking opium in other form. It is very danger to our nation and ourselves.
So there's there's a question that what about how far the homeopathy is percolated to the grassroots level in Tamil Nadu? What is your opinion, sir?
I am treating, I was brought up by homeopathy in very, very village level. Yeah, there is no roads also. I carry my bag with a lot of homeopathy medicines. I went there, villages, houses. I conducted so many camps. Even that local people were told that it was some magic or miracle. He is doing some jadikar and all. Okay.
It's because the common man is obsessed with injections, especially in the socio-economic level when they're going down or up. The extremes, they're always preferring for certain injections they want. What is your opinion, sir? Please unmute. Even the primary health center where the doctors, they were criticized. He don't know, he never gave injections. He's what kind of doctor he is. That's the question.
No, what happened nowadays? People will pay for one injection 100 rupees or 200 rupees. That's why they are offering. We'll give some prick and all. Once you come to know that the reality of homeopathy, you may not thought of injection. Our medicines are far better than injection.
That we know, but they don't know. That is a problem.
Yeah. And they are just bending themselves according to public.
Yes. Okay.
We have to give proper counseling and we have to teach proper reality to them. What is homeopathy, how they differ.
Sir, once in Kerala also was like that. Once. Kerala was also like that. See, gradually Kerala people understood about the efficacy of the homeopathic medicine, and government of Kerala so highly propagandated it and started homeopathic dispensaries at government level. And slowly, see, in Kerala it's understood what is homeopathy, and they understood the effect of homeopathy, and they realized the soothness of curing. And now.
And another one thing I want to mention here, many times the placebo also have some effect. If you tell it is the main tablet for healing this and this, that will be healed. Like the same way, those who need injection, as like this placebo effect, even if you give aqua distillate also, it will work.
Okay. See, see, you are correct. You are correct. See, I also done it that. I injected distilled water once. Distilled water once I injected distilled water and gave bryonia. And I charge it once. I also done it. Okay, good. This is the history of homeopathy. They see certain patients will come after an injury and ask me to take the toxoid. Suddenly I give some distilled water injection and give the ledum 3 dose, 3 dose I will give and charge for it. There is no problem.
Thank you, Dr. Hariharan, for your beautiful conversation. And I'm inviting Dr. Manoj to giving vote of thanks to Dr. Nagendran and for moderating our Malayalam session.
Thank you, Dr. Ajini. It's a nice presentation. And what is more important is the attitude of Dr. Nagendran. He's very, very enthusiastic and always trying to learn something and trying to do something new, different. That is most important. I think a lot of physicians should do in that way. Then homeopathy will become the number one system in the world. It's a need of the hour, I think. So on behalf of Ifph, I'm expressing sincere thanks to Dr. Nagendran and those who are not participated and those, especially those participating in discussion. Thank you.
Thank you, sir.